a starter offer for our. You know, I want to do this especially. So one of the cool things about the Night News Challenge is that it's run in part by John Bracken. And John Bracken is an asset to the city of Chicago, even though he works for a national organization called the Knight Foundation. So what I'm going to do is I'm going to pick up the slack for John. John, how many of these have you done throughout the country?
We're doing 21 total. This is probably about the midway point of those 21.
So you've been all, where were you at this week?
San Diego, Long Beach, and Los Angeles. And Detroit Sunday, and St. Paul Thursday, and Madison Wednesday.
So you're on a road show.
Yeah.
You're going to rooms just like this to do this stuff. So just for the heck of it, you know how whenever you live across the street from the church, you're always 5 minutes late. You know, it's sort of like the home team disadvantage. So I was going to provide pick up a little bit of slack for John and do some talking. Which is not to say that I really know what I'm talking about, because everybody here, as I was listening, and obviously I know a significant amount of you and work with you and for you. It's a really exciting opportunity to be here at the Trust to think about this topic, and here's why. The Knight Foundation. How many people here know about the Knight Foundation? What have you done with the Knight Foundation? And what do you know in general? Just shout out. What do you know about the Knight Foundation?
Big supporters of journalism.
Journalism.
Very committed.
Okay. Abel, what do you think of when you know about the Knight Foundation?
That's as far as I got.
Journalism.
Yeah.
What else about the Knight Foundation? Other people raise their hand.
We're giving away $2.2 million.
I heard
There
this.
we go. There
Wow!
we go.
Ding, 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 ding. So the Knight Foundation is.
Just one, 2 points.
It's an organization that has been important to me in my career, in my life, since about 2007, because I was a recipient, along with many others, including Adrian Holabody, who actually came up with the idea for everyblock.com. So if you've ever seen Everyblock, it's a local news and public information website that was focused on data and community. So the interesting thing about the Knight Foundation is they've always been interested in journalism and community, and that's kind of the funny part, because they grew. Not to say that I'm a complete expert on the subject, but I know that the James L. and John
S. and James L.
John S. and James L. Knight Foundation is kind of like a lot of foundations, as we can attest. Those of us who work in or run foundations are idiosyncratic, and they were idiosyncratic in that they worked mainly in the cities in which there were newspapers run by the Knight brothers, and which was then purchased by what ended up being Knight Ridder. That's when I first came in contact with, when I first became knowledgeable about newspaper companies. So you do a ton of work, and you mentioned a bunch of cities, John. And in every block, I became really familiar with those cities, which were, like Detroit, and I always have to say Rock City after I say Detroit, right? Detroit, Rock City, San Jose, Miami, of course, where they're based, and it's this sort of Charlotte, Charlotte, North Carolina. It's this sort of idiosyncratic thing based on the great work of the Knight brothers. But they've always been interested not just in journalism, but how journalism and how information can meet the needs of communities. So then the rest of the story, as far as I'm concerned personally, is that now my work here at the Chicago Community Trust. Chicago Community Trust is a big partner of the Knight Foundation as well, especially in that community information needs area. So you have these, that when everybody raised their hand, the first thing they said was journalism and money. That's my experience too. That's what the Knight Foundation was interested in. But I've just been very impressed especially having to, run a really small organization that has something to do with trying to help communities, but then being a part of a very large organization that tries to help communities. I've been impressed with the way the Knight Foundation construes their mission. And if you see the trend and the way that this Knight News Challenge has gone, going back to 2007, when Every Block was one of the first recipients, it has construed their mission in more sophisticated and more open and more broad ways. And that's why the people who are here, who know far more than I do about health and the information needs of communities, that's why John happens to be now just a few blocks away from his home instead of a few thousand miles away from his home, talking to a group of similarly situated people who care about these things. So the idea of the information needs, John, I think that the last news challenge you had was about open government, which is a topic that I actually do know a little bit about, rather than health. And I helped out with that, and I saw this movement from journalism, from the idea of what's in the news, and moving towards what are the sources of the information that can be of use to people in order to make their lives better. So this next movement into the Knight News Challenge Health, $2.2 million, Scrooge McDuck, jumping in the puddle of the pool of money, is impressive to me. I like where that's gone, and that's why we wanted to help convene this set of people on a Friday afternoon at 4 o'clock. I'm also highly concerned that you're not eating enough food. I don't see any food in front of anybody. As soon as I'm done talking, I'm going to go outside. And I'm going to bring the food inside. Thank you, sir. And I'm going to place it in front of you, because I do all the important things. So I just wanted to frame it slightly and talk a little bit more about the Smart Chicago Collaborative and why we care about this stuff, and why, and without getting too deep in a lot of, obviously we're partners in a lot of stuff, so I thought we would just maybe frame those kinds of things that we're already working on. Without being that guy who says, "Oh, health, I do health," right? Don't you hate that guy? Right? I'm more interested in hearing what we're all. This is a brainstorm to hear about everybody's ideas. But anyway, the Smart Chicago Collaborative. We start every meeting talking about our principles. Our principles really actually matter to us. We're about technology. We're a civic organization devoted to improving lives in Chicago through technology. And that could have been anything in the world until I said technology. That is the frame that matters to us. So we want to improve lives in Chicago, and we do it through technology. The concept of open is really important to us. It's not just open source and open process, but it's open process, open mind, willing to change, willing to be moved, to be opened, FAFTA. We're about everyone in Chicago, and I think that, frankly, that's something I've always appreciated in my young life of working in this space with so many of you, is that if you think about many nonprofit organizations, naturally they have to focus on a particular geographic area or a particular cohort, or because your focus has to be really specific in order to get things done. Here at the Trust and at the Knight Foundation, they care about everyone. Everybody has to be in the game, and I think that healthcare and the community health is one area where everybody matters. Everybody has to be included. I've been at meetings at the health department, and it's a system of the entire region that you have to care about. And then, of course, Chicago is our frame, but we care about everybody. So it's the Chicago Community Trust, which I talked about, the MacArthur Foundation in the city of Chicago. And just wanted to say a couple of words to kick off our thinking. This is not rocket surgery. Anybody could have come up with this slide, right? But it's worth just noting what the confluence is. There have been incredible investments, hundreds of millions, billions of dollars spent on health records, and new systems and new payment systems and new tracking systems and new pharmacy systems. I'm not so sure how much of that has benefited patients and consumers. And people smarter than me have said the same thing. But we know that they're there, and we know that the software is there. That's one part of the opportunity. The other obvious one that doesn't take a genius to figure out is the enormous regulatory change that's coming down, starting in a couple of weeks. Well, it's been starting for a long time, but another inflection point in a couple of weeks with the Affordable Care Act and the ability to sign up. And states are scrambling. Here in Illinois, they've awarded 44, including some people here, I believe, 44. Grants for in-person counselors to try to get people to be able to sign up, talking about engaging with the community, to explain to them an extraordinarily complex thing. In general, in this context, there's the pop culture role of big data. Again, speaking of Chicago, we've seen with the Obama campaign and the sort of, big data is a thing, and everybody cares about data, and where's my data, and we're going to make everything more efficient, and is the NSA gathering all of my data. Data is a big deal, okay? But it really hasn't reached into the health field as far as I can tell. There are some here who have cared about this much longer than I, including obviously the humble Jim Alexander here at the end of the table, who's been fighting this. Here we are convening this little meeting about some money, and there's a guy, Jim Alexander, over here from the Otto S. A. Sprague Memorial Institute, who's been in the trenches for decades, thinking about this stuff, funding this stuff, caring about this stuff, pushing forward, and Becky Wirtz on the board there, pushing forward new things, whether it's obesity or text for baby or other things like that. So I think that that those kinds of strengths that we have here in Chicago are unique to all these other random places that Bracken has to go to in the course of his job. And we have a lot of good things here. I think another trend in this opportunity is the popularization of transparency, and I do say that word popularization in a mildly almost deprecatory way, right? It's a popular thing to be transparent. Certainly there have been some concrete advances on this in terms of government data and things along those lines. But, this work of trying to do community health is directly related to this concept of transparency and accountability for who we are and what our conditions are and how we're treating ourselves. And then, in general, the trend of open data, which I think we can agree, and I'd love to hear more, and it might be a topic of discussion, how much open data has reached into these realms. And I know there are many here who are protectors of personally identifiable information and things along those lines. They're enormously difficult questions that we have to grapple with. So just briefly, we are practitioners. I don't want to talk all day and all night about what we've done, but yes, the Smart Health Centers and a number of our partners are here. Is one way that we bring technology to communities through simple digital skills training, by allowing people to use the internet to find out information about their conditions, to hopefully be able to get them to look at their own medical records, which frankly I can't even figure out on my own, and in my own system. And that is the Smart Health Centers is the brainchild of Jim Alexander, as is the Chicago Health Atlas, and the incredible work of Abel and your team and others. It's good to meet you. I don't know if we ever met. Working on this, this groundbreaking work of trying to present citywide or bigger cohort data while still protecting the rights of consumers. So I'm really happy to have played a small part in this. I want to continue doing it. I know the Trust wants to continue doing it, and apparently the Knight Foundation is interested in it as well. So anyway, we all have mitts. We all are in the game. So let's. Those were some initial thoughts, John Bracken.
Thanks. Chris, can I sit? Is it okay if I